This video focuses on the anterior cervical discectomy and fusion procedure. My name is Dr. Pablo Pazmino. I can be found online at spinecal.com. These are some of the hospitals where I'm on medical staff. What we've been seeing lately is that patients are now traveling from the South, from the Midwest, and even internationally to have us perform their procedure here at the Spinecal Institute. Now let's focus on the anterior cervical discectomy and fusion procedure. This is done for disc herniations in the neck. You can see how when a disc herniates, it can put pressure on the nearby nerves. This pressure can cause pain radiating down the arms. The damaged disc can cause neck pain. Now let's take a glimpse of what I see during the actual procedure. In this view, we're seeing two bones which are now bone on bone resting against each other. This will have to be opened up during the procedure. This is an anatomic view of what we actually see during the procedure with the bones as they're separated. To remove the disc, we use this grasping type instrument to sequentially move each piece. After it's removed, this is what it looks like. Two bones separated. Now, what do we put inside and in between those two bones? The instrumentation I like to use is a cervical peak cage that stands for polyether ether ketone. It's essentially a surgical grade plastic. These cages are then packed with bone. That bone can come from yourself or a donor. Next, the completed cage is placed between those two bones we demonstrated earlier. These cages are then secured against the bone with a certain type of plate. And finally, there's a cartoon representation of what that would look like. Now, let's look at a patient who's 6 months after surgery. What I'd like to call special attention to is all our patients from Spinecal are very well educated in their pathology. You go to great lengths to make sure you understand your surgery, what the x-rays look like, the entire recovery process. Please watch.
Hello, I'm a patient of Dr. Pazmino. Fantastic surgeon. I've had the discectomy surgery. He did it July 12th in 2011. Here 6 months later, I have no complaints whatsoever. This is where he did the surgery. After surgery, I was given pain pills. I did not have to take one tablet, not one. I had no pain whatsoever. I was suffering from numbness in my both hands and my right arm and both legs. The numbness was gone in 2 weeks. As you can see here, this is a surgery that Dr. Paz did, and this is after 6 months of healing. And as you see right here, is where the fusion is actually taking place. Dr. Paz really did a wonderful job. I'm very, very grateful for what he performed on me, and I feel great. And here's my range of motion. No pain, a little stiffness, but that's expected. But everything is great on my end. Thanks again, Dr. Paz.
Thank you for watching this video on the ACDF. Because of demand, we've had to expand to 3 offices to serve the entire Southern California basin. Here's our main hub in Santa Monica. We're also seeing patients in Glendale. And here's the office phone number to schedule a meeting there. And finally, here's our office address and phone number in Long Beach. If you or someone you know could benefit from an anterior cervical discectomy and fusion, feel free to contact us. Here's our phone number, a 1-800 number, and a direct email for you to use. Thanks again for your time.